Amuru district in northern Uganda is recovering from the harsh bruises of protracted civil strife, which kept large communities in internally displaced people's camps for 2 decades. Resettlement has come with a host of challenges, including the need for adequate health services. Through funding by AMREF Flying Doctors in Netherlands, AMREF Uganda is supporting improved access to sexual and reproductive health and rights in 2 sub-counties in Amuru district in partnership with the district health management team as part of a holistic health package, including infrastructure innovations, capacity building for health staff, and community mobilization through the establishment of 60 women and youth groups. There are 30 groups in each of the 2 sub-counties of Amuru and Atiak.
This approach is effective in improving awareness of the community as a whole. Men have the opportunity to have perhaps a radio, perhaps a mobile phone, but the women and youth do not. So organizing them around awareness and providing them with information has been very, very effective.
After establishing these groups together with the sub-counties, we walked these groups through the steps of registration. And they were able to register with the sub-counties and district authorities such that they are recognized and known as existent groups. So when we empowered these group facilitators, they in turn went and trained their group members. And also we trained them in village saving and lending association management and how to save. So we introduced 2 bags. There is the VSLA bag, where they are able to contribute money for their welfare and their other livelihood activities. And then there is the health bag, which we call Saving for Health.
The women and youth groups are already making a significant change in improving the quality of the livelihoods of their members and facilitating access to health services through savings and loan activities, as well as Saving for Health, as reported by group facilitators.
Anangyo mawachao bolchobe dwema reo. Oi dwema bichiel no watigi miliona bichiel. Haya ni aisha ni dwema bichiel mi oi dwema pani. Wanana te buk mukene potum no watigi miliona pa. Gien mege beno igamo ni chene mi chera temo biashara. Biashara no kene golote war la cherege waro nyanya ge bele nyanya ge ena nana mege ge bere gare chu pinga wan wa chen ini ka ini gam chere chama gin mi dwa kere pe no mer kere biashara chen mi yot kom mage raya bero alimia dek piara por aya gi mama fora ka kara dek bero alimia bero 20 million aya gi gamo mati waka obere no miliona abisiel gedwa don tege cha alimia der.
This innovation of pooling funds in a health bag contributes significantly to Uganda's efforts to promote social protection among vulnerable groups like peasant women, children, and young people to enable them access health services.
Many of the health services which we provide require some resources. Sometimes if the medicines are not there in the health facility, the individuals need to go and purchase it from outside the health facility, and this requires money. So if they mobilize themselves into groups, into village savings and loan schemes, they are able to keep some money, and when there is a sickness, somebody is able to get this money, borrow, and then go and get treatment. He's well, he continues to work and earn more money, which is very good. It's working in the district.
AMREF's training of health workers in Amuru district is going a long way to support Uganda's efforts to achieve universal health coverage by 2030 by ensuring that competent health workers provide quality services in every part of the country.
AMREF train all midwives in Amuru, plus other cadres, like the nurses, who are all trained in basic obstetric care. With this, our midwives are well versed with emergency cases, obstetrical emergencies, and resuscitation of newborn. And they did not stop there. Follow-up of the midwives was made quarterly. Mentorship, support supervision was done concurrently.
We learned that really it is very, very important to shade relationship with these pregnant mothers and then the mothers who comes to deliver, not only even to attendants. So after we've been initiating that good relationship between us and them, we laugh, we chat, it has increased the number of my mothers in the ANC. And they love me so much. I get a lot of presents from them. Before, I used to deliver 9, 10 mothers in a month. But after the training and the rest of the services, it has now increased. In a month, we deliver from 20 to 28.
An important aspect of the services provided through groups are the referrals to health facilities by trained group members. Expectant mothers are among the beneficiaries of this innovation, which encourages many of them to seek antenatal care and delivery at health facilities made easier by availability of funds which they can borrow from the group health bag.
In 2017/18, we had antenatal attendance for women, that is the fourth antenatal. We were at 38.6. But last financial year, we have now moved to 42.1. That means there is a big impact. We go to deliveries. We moved from 51.3 to 59.1. And this is about the national target. Our national target is about 57, so we are at 59. It is a great improvement. And it's one reason as to why Amur has moved from 51 in the country to 23.
As part of support for youths to get information and services on sexual and reproductive health and rights, special youth days are organized, during which health staff give talks on different topics, including STIs, family planning, and general hygiene.
They gather us together, so we teach ourselves. One is able to know who is who, cooperation is there, and AMREF has taught us. We are able even to teach ourselves on this methodology of black. So we know how to prevent ourselves on STIs and STDs.
We have quite a number of areas that we are now supporting these youth. One of them is, when I talk about in the family planning issue, we are now giving them condoms, condom distribution during outreaches. We also have here, sometimes they come and ask direct for it. And normally when they come, they are free and sent direct to laboratory for screening. Other services like circumcision, we have linked them, our youth, to those services. You know, in the world of HIV, circumcision is one of the activities in the fighting of the HIV.
The principle of a healthy mind in a healthy body guides the youth groups who actively participate in sports as a means of engaging in positive recreational activity and team building. These activities help the groups to bond and strengthen their activities together.
Whenever we meet them, we engage them through different activities. Because they are young people, we come with health workers. So health workers are able to give health talk and give health services, basic services, like family planning. They do HIV testing because it is mandatory for our group members to be tested, such that they're able to know their status, yes. And other methods are offered, other services like malaria tests and STDs and STI screening. We also do screening for cervical cancer and breast cancer whenever we come with the health workers here during these outreaches. We believe that empowering communities with the right sexual reproductive health information will enable them to demand for these services. So that's why this project comes in. So we are building the gap that was existing in the communities. Of course, there are those areas we have not reached to in the district. We work in 2 sub-counties. That is in Amuru and the Tiak sub-county. The other sub-counties that we feel we would want to reach, such that we have this model expanded